Today we are going to talk about the osmotic diuretics. Drugs in that category are the mannitol, glycerol, isosorbide. This most commonly used drug in the osmotic diuretic is the mannitol, which is administered intravenously. And the most important thing, it is a pharmacologically inert substance. Mannitol is a pharmacologically inert and it will get freely filtered at the glomeruli. It will get freely filtered at glomeruli. Then glycerol. Glycerol and isosorbide, these two drugs can be used orally. These two drugs can be used orally to reduce the intraocular pressure in acute congestive glaucoma, where they use in the acute congestive glaucoma. Now, what is the mechanism of action of osmotic diuretic? They draw water from the tissues by osmotic action. They draw water from tissues, means from a region of higher concentration to the lower concentration through a semi-permeable membrane is called as the osmotic action. And because of that, this results in the increased excretion of water and electrolytes. There is an increased excretion of water and electrolytes. And where it acts, what is the site of action? In the loop of Henle and in the proximal tubule, where they act at the loop of Henle and the proximal tubule. Okay. Now we'll see mannitol. When it is given intravenously, what does it do? When it is given intravenously, it increases the plasma osmolarity. And because of increases in the plasma osmolarity, there is a shift of fluid from intracellular compartment to the extracellular compartment. Shift of fluid from the intracellular fluid to the extracellular fluid, and because of that there is increase in the ECF volume. Extracellular fluid volume will get increased. That will increases the urine formation. And that will increase the water diuresis. Then when mannitol is given intravenously, it will get freely filtered by glomerulus. Osmolarity of the tubular fluid is also increased, so that water retained in the PCT and descending limb of loop of Henle, and that's also increases the water diuresis. How come water diuresis increase? By two ways. When it is given intravenously, it increases the plasma osmolarity, and that's why there is a shift of fluid from intracellular compartment to the extracellular compartment, so that ECF volume increases. It increases your urine formation, it increases your urine volume, and that's why water diuresis. And mannitol, it will get freely filtered by glomeruli because it is not reabsorbed. It's a pharmacologically inert substance. It increases osmolarity of the tubular fluid, water retained in the PCT and descending limb of loop of Henle, and because of that there is increased water diuresis. What are the uses where we can use this osmotic diuretics? First of all, mannitol. Mannitol is used to reduce the elevated intracranial tension, elevated intracranial pressure or intracranial tension following head injury or brain tumor. Whenever there is a brain tumor or head injury, there is increase in the intracranial pressure. Okay, so how it helps mannitol? Because it draws fluid from the brain into the circulation by osmotic effect. What does it do? How it reduces intracranial tension? By drawing fluid from the brain to the systemic circulation by osmotic effect. Then mannitol 20%, glycerol 50%, which is given orally, and isosorbide, which is also given orally, are used to reduce the elevated intraocular pressure in the acute congestive glaucoma. If you want to treat acute congestive glaucoma, that means you have to reduce the elevated intraocular pressure. How come intraocular pressure is reduced? They draw fluid from the eye by osmotic effect into the blood. What they do? They draw fluid from eye to the osmotic effect. They draw fluid from the eye into the blood. and that's how intraocular pressure is decreased. Now third thing, this mannitol is used to prevent acute renal shutdown in shock condition, cardiovascular surgery, hemolytic transfusion reactions. Whenever there is a hemolytic transfusion reaction or cardiovascular surgery, or in case of shock, to prevent the acute renal shutdown, we use the mannitol. Mannitol is useful to maintain the osmolality of the extracellular fluid after dialysis. After dialysis, you have to maintain the osmolality of the ECF, extracellular fluid, and in that mannitol is useful. Now, what are the adverse effects of this osmotic diuretics? There is a marked expansion of the ECF volume, which can lead to the pulmonary edema. There is a chance of pulmonary edema because there is an increase in the ECF volume. Headache, nausea, vomiting may also occur. And glycerol, if you are using, there is a chance of hyperglycemia. Glycerol causes hyperglycemia, headache, nausea, vomiting, and there is a marked expansion of the ECF volume, which may lead to the pulmonary edema. Pulmonary edema is caused by mannitol because it increases the ECF volume. That's all. Thank you.